Hi, and welcome to the Psych, Health and Safety Podcast. My name is Jason Van Schie, and I'm one of the hosts of the show. The aim of the podcast is to rapidly increase the knowledge and application of psychological health and safety in workplaces worldwide. To help with this, we have regular guests from around the world who are leading the way in this important area. But before I introduce the topic for today, allow me to introduce my co-host, Joelle Mitchell. How are you today, Joelle?
Today I'm all right. There's been a lot that's happened since our last recording. It's been a few weeks.
Yeah, it has been long.
It's been so our borders have opened. We're currently getting towards the peak of our Omicron outbreak here in WA. There's war in Europe. Zelensky is being a fantastic model of leadership. Our first war in the age of TikTok, which is very interesting. Lots going on. Also, my air conditioning broke, so I'm currently sleeping on a mattress in the lounge room with a portable air conditioner, which is great, but, minor in the grand scheme of things. Went to a wedding. That was nice. Yeah.
Wow, lots going on.
Lots going on.
And a little bit of 2021 creeping in there with your aircon breaking down.
Yeah.
We shouldn't have mentioned anything at the beginning of the year.
No, it's your fault.
Yeah, I'll take the blame for that.
Good.
No, look, glad that you're doing well. I'm doing better as well. I have already successfully gotten and recovered from COVID. So,
well, you're sounding very nasally, so whether you've successfully recovered or not is still questionable. I think we could say that you have caught and are no longer infectious with.
Yeah, and we're talking about before whether it was a sexy voice or not. And you said nasally is not, hoarse is more the sexy voice.
Yeah.
Yeah.
Not hoarse as in...
Can't speak at all.
Or the animal.
No.
No.
Nay.
Yeah.
Yeah.
Nay.
No, not like that.
No.
Yeah. So, look, I'm sure I'll be fine. I know Alicia actually did a podcast with us a while ago as she was on the back end of COVID as well. She made it through. I'm sure I'll be able to make it through as well.
And we'll let our listeners tell you whether your voice is sexy or not.
Yeah, I know what that's going to come back. So don't worry about emailing in, listeners. And we've got Jack on the back end who will be, taking out any coughs or sneezes or anything like that.
Yes.
It will sound amazing, podcast episode.
It will. There will be no coughs or sneezes.
Speaking about this episode, we actually don't have a guest for this episode. Well, kind of we're both guests, I guess.
We are.
On this particular episode. We've been thinking about it for a while, doing what we're calling, probably will become known as our expert series. So we're commonly talking to clients in market, Joelle, myself, Alicia in particular, and kind of uncovering what are some of the key issues or objections regarding psychosocial risk assessment and psychological health and safety. And we thought maybe what we could start to do is every so often do a talk just between Joelle, myself, and maybe Alicia from time to time about some of the key questions that are coming up. So this is really for those people who are trying to do this either internally or as an external consultant, trying to work with your clients and work through some of these challenges that they're having. And hopefully what we'll be able to do is to maybe break down some of these things a bit more than what we get to do normally when we have a guest on the show. Yeah. So today, what we thought we would really focus on is in Australia in particular, there are new draft regulations that have been brought out by Victoria, and we had Libby Brooke from WorkSafe Victoria talk to those very recently. But maybe we thought we'd bring them out a bit more because we are also expecting Commonwealth draft regs very soon in the psychological health domain. This isn't necessarily something that will affect all of our listeners worldwide, although you might be interested as a fly on the wall looking at what's happening in Australia because it could signal what might potentially happen in other markets around the world. But obviously what we're talking about is best practice regarding psych health and safety anyway. And we'll talk also in today's episode regarding psychosocial risk assessment. It's something that we have spoken about previously on this, but I don't think we can speak about it enough given that there's still a lot of unknowns and differing advice going around the traps regarding what does the psychosocial risk assessment look like and what's the sort of time commitments associated with that and whatnot.
Yeah, and I think even for those listeners outside of Australia, if you are in a jurisdiction where general duties health and safety legislation applies, then a lot of what we'll be talking about in this episode will be relevant for you anyway. Yeah, so
Joelle, I guess the first question I have to ask you is with all these draft regulations coming out and codes of practice, we've had New South Wales and WA most recently released codes of practice around psychosocial risk management. Why now? Why is this all happening at this point in time in our history?
Because everything is garbage.
Okay.
No. I mean, yes, everything is garbage a little bit. Look, I think in Australia we've got, a timeline of things that have happened since the Boland Review that have sort of led to this point, where there's been an increasing awareness that, we've got a growing mental health burden in Australia. Lots of the focus remains on downstream, so treating people once they're already unwell. A lot of that is focused on early identification and early treatment of symptoms, which is good and important. But, there's recognition that employers have a really big role to play in the prevention space. And what employers have been doing so far typically has been focused downstream on that, encouraging people into treatment, giving them support through, employee benefits such as EAP, early identification and referral and that sort of thing, and giving people those types of supports. But that's not prevention. And so, as we know with physical health and safety, if the conditions that you're exposing your employees to in the workplace are making them sick, you have a legal and an ethical obligation to do your best to prevent that from happening.
Yeah, and I've got to say, I was just talking on a call I had with a client earlier today, actually, about this. And I think the reason that we have such an illness and individuals and symptoms focus is from the public health approach. And we do have some very well-funded and well-meaning not-for-profits that work in the space. And they are trying to raise awareness of what mental illnesses look like and pathways to treatment. Unfortunately, you could say in Australia, and we're hearing similar around the world, access to treatment is actually becoming very difficult.
Yeah, that's true. And I think there was recently the report released from the World Health Organization reporting on the global burden of disease study for 2020. So roughly a 25% increase in major depressive disorder and anxiety disorders globally, and that was in 2020. And what this meant was a 253.2 additional disability-adjusted life years per 100,000 population, which is just crazy. I don't know. I don't have the words to describe that, but 250 years of disability-adjusted life years per 100,000 population is just horrible. So yeah, I mean, we can't just keep relying on people sweeping up the mess. Our clinical services have a really important role to play. But we can't just keep relying on them to solve the problems that, a lot of the times have been created by poor employment conditions, poor leadership, all of that sort of thing, or, going further up, public policy and all of the implications that come along with that. So, we really do need to start thinking about upstream solutions, thinking about prevention in a really a more systematic and structured way.
Yeah, and I know we'll be preaching to the choir for most of our listeners, particularly those from a health and safety background, who would understand that injury and illness is more of a symptom of poorly designed or managed systems rather than individual behaviour. And so, going upstream and doing prevention is not just better for everyone's health and well-being, and preventing a lot of these illnesses and disability-adjusted life years, as you said, but it also is much better bang for buck if you're thinking about your investment as an organisation. If you can prevent these things from happening, it costs a lot less doing that than sweeping up the mess, as you say. Yeah,
I mean, and going beyond that as well, if you're treating your employees well, they're more likely to stick around. They're more likely to be productive. They're more likely to engage in organisational citizenship behaviour. So there's a lot of other reasons to pay attention to this other than just, what is your workers' compensation premium looking like?
Yeah, and I really hope that given employees are starting to understand, well, it's a pretty open environment in terms of work, and I've got a lot of choice now in terms of I could be a freelancer and work anywhere around the world from my own home now. I could go work for an employer who actually does care about me, and I'm not going to put up with his rubbish. So people are starting to see that more and more. And so therefore organisations are, more so forced to consider the working conditions and how they're supporting people to thrive. Because it wasn't that...
Or they just complain that nobody wants to work anymore.
Yeah, that's right. So hopefully they start to understand the benefits of doing this, and not just, this is another burden or another responsibility that we've got that we don't want to do, or we just want to tick the box rather than doing it properly and actually understanding or realising all the benefits that we're talking about. Because it wasn't that long ago when it was a different market, particularly here in Western Australia, when, we're such a resource-reliant state. When there is a boom or commodity prices are high, all of the resource companies start to employ, and they typically pay very well, and there can be there's lots of jobs and other opportunities. When there's not so many jobs going around, then the employers become, I guess, more able to pay less or provide less benefits, or have lower levels of turnover, because people can't just move to another position that's paying better or offering better benefits. And it wasn't that long ago when I was in the room with a senior a human resources leader who had commissioned myself to come in and do a audit regarding the different stresses that people were experiencing. And there was some things that came up, and she basically said to me, Jason, we've got 1% turnover. Who cares if people burn out? Like, we can just replace them tomorrow with someone else. There's lots of people that want to work here.
Was she like wearing a monocle and rubbing her hands together, and like, did she have a fluffy white cat in her lap?
Yeah, she could definitely be a Dr. Evil type or a Cruella type or something like that.
Yeah.
But,
wearing a coat of puppy fur, yeah.
I really hope that's not... And look, I should say, I know that's not the majority of people who think that way. But what I'm hoping is that the silver lining of COVID and the pandemic, people are understanding mental health is important, and it is good business practice to do workplace mental health and deal with psychosocial hazards well.
Yeah, and, in terms of drivers, now is the time that employers are going to be most driven to do something about this. And I guess we can just hope that when the situation changes and potentially, the job market moves back into a position that favours employers, that they don't scale back what they're doing in this space.
Yeah, and I guess here in Australia, we will in the future have, rigorous legislation that's hopefully got lots of case studies of it being enforced as well.
Yeah.
That will demonstrate to employers that they can no longer just ignore this.
Yeah, and that's one of the reasons for having the legislation in place, because when those market drivers ease off, you still need the laws in place to maintain a certain level of performance.
Yeah, that's right. So, Joelle, one of the questions that we get asked, particularly pertaining to legislation, is how does, I guess, the new draft regulations here in Australia and the codes of practice differ to ISO 45003?
So I guess the main difference is in the requirements for their applications. So all of the ISO standards are voluntary standards, so companies can choose whether or not they want to adopt them. And, there are various implications for adoption of standards depending on, what industry you're in, supply chain and all of that kind of thing. So there can be significant benefits in achieving certification to an ISO standard. But even if you don't actually need certification, there are definitely benefits to having a system that's aligned to an ISO standard as well. And I think what a lot of research has shown is that companies will sort of get to the point where they've got their systems aligned to a standard, and then, the benefits of actually having certification, unless you're actually in somewhere in the middle of a supply chain, there's not that much benefit in having the certification. But yeah, so any ISO standard is voluntary. I guess it represents and, we've had people on in our very early days of the podcast talking about their contributions to the development of the standards. So, it is developed by a committee of global representatives. So, there's always going to be, decision-making and trade-offs that go into the development of that type of a document when you do have that many different stakeholders from so many different, countries and different interests and different political motivations for contributing. Without having been involved, that's probably all that I can say about that. And even if I had been involved, I probably wouldn't be able to say anything about that. So I guess, recognising some of the practicalities of what that kind of a standard actually results from is important to bear in mind. So when we look at something like regulations, these are typically drafted by... They might be drafted by a regulator, or they might be drafted by, a department sort of bureaucrats with input from a regulator. So they tend to be more focused on the, the relevant information for their particular jurisdiction. What are the issues that they're experiencing? What are things that are being reported to them? So they can be, I think, a lot more targeted. And certainly while there is still a political layer over anything relating to regulation, there's probably not as much in the way of trade-offs as you would with that sort of international approach with ISO. So I think with regs, what we would see is a lot more focused in terms of what they're requiring their employers to do. And then codes of practice. So regulations are sort of, mandatory. You need to demonstrate that you're complying with those regulations. And then codes of practice are a way for the regulator to put forward essentially a sort of a baseline of performance expectation about how you're going to meet the regulation or the Act requirements. And so these documents can become evidence in court proceedings, in prosecutions, to say that this is actually the established minimum requirement. So as an employer, you essentially need to be able to demonstrate that what you're doing either complies with that code of practice or is better than or equal to that code of practice in terms of the outcomes that you're delivering. So, I guess in terms of enforceability, if you like, it starts, the Act is the most important component of the legislation. The regulations give greater instruction around how to meet your duties in the Act, and then the Code of Practice essentially provides an example of how you can go about meeting your duties under the Act and the regulations. But you can choose your own adventure, if you like, with the Code of Practice, as long as you're demonstrating that you're meeting the requirements within there.
So for a company that decided they wanted to adopt ISO 45003, where they do have clear legal requirements, if they were to adopt ISO 45003, would it meet their legal requirements in most instances?
Yes. Yeah. I mean, for the most part, so the Victorian regs, for example, have a requirement for action plans to be put in place where organisations have identified particular psychosocial hazards. So that's not something that's covered in 45003. So there will be nuances. Yeah, that won't be covered by 45003. But in terms of actually the general duties to identify hazards, assess risks, put control measures in place, do the plan, do, check, act thing that's sort of embedded in your safety management system or in any of your risk management systems. If you've got those processes in place for psychosocial hazards as well, then you're going to be well on your way to meeting the majority of your duties under the legislation.
Yeah, great. Yeah, so that is what I had understood. So great that I've got that same understanding as you. But that question does come up a lot, so hopefully that helps with some of our listeners. Now, do you believe the regulations, codes of practice put new obligations on employers that weren't previously there?
I think that they clarify the obligations that have already been there. Certainly the duty to protect employees from health and safety hazards has always been there. The recognition that also includes psychological or psychosocial hazards, I suppose, is a relatively new idea. I'm sure that there are people out there who will argue about whether or not that requirement has always been there or not. I guess the point is that, when you're talking about health, and we've got, globally recognised definitions of health, for example, from the World Health Organization that include psychological health. I suppose, there's people who could say that, the regulators, by suddenly deciding that, now we're going to include psychological health when we're saying that you have these general duties, is potentially shifting the goalposts. So that's maybe why we're now moving to a position where we've got specific regulations to make it more clear to employers that these duties do actually include psychological health as well. Other jurisdictions are just making changes to their act and including, the in their definition of health, for example, that includes psychological health. So that's another way that regulators are able to approach this.
Yeah, and I got to say, from the regulators, we're getting a clear indication that these will be not just more enforceable, but will be enforced. If we think about Libby, she was the first person that WorkSafe Victoria kind of brought into a specialised role regarding psychological health. She's now got 5 psychologists in her team, and they're recruiting 2 more. So they're definitely building up competence and capability within their teams. Yeah,
and the same goes here in WA as well with Demers. They've been recruiting quite heavily in this space, and certainly, feedback that we've had from clients and people in industry that we've been talking to is that Demers have been paying close attention to what they're doing in this space as well. And so, taking action that's not able to be made public, but in terms of, receiving notices or instructions from the regulator that they need to be taking action in this space. So, that's the feedback that we've had from a number of different industry contacts in WA.
Yeah. So besides the need to, I guess, notify the regulators of specific hazards like sexual harassment, for example, what are the other kind of main components of the regs and the codes that employers need to be mindful of and make sure they've got a process for? Yeah,
so essentially identify that it's the same as it is with your physical health and safety requirements. You need to identify your hazards. You need to put controls in place to address the risks associated with those hazards. You need to monitor the effectiveness of them, and you need to maintain that process of continuous improvement.
Yeah. So I guess that's the next part of what we wanted to discuss today. How can companies take that plan, do, check, act approach and particularly meet their legal obligations that are obviously, particularly in Australia, going to be far more enforceable?
Yeah. So I guess drawing on that, why do you think that organisations aren't actually already doing this typically in terms of that proactive, hazard identification and risk assessment approach?
Well, to quote a really intelligent person I know, everything is garbage. So the tools, I think, that are currently in existence that claim to be psychosocial risk assessments
are garbage.
They have not changed in 20 years. If you think about the HSC stress indicator tool, for example, it's probably the first popular example of a psychosocial risk assessment. but really they don't give the information required to satisfactorily understand and then address risks and monitor them over time. These tools are typically employee perception style measures, which I'll say when trying to understand psychosocial risk is very dumb in that they don't give us great information. To understand the likelihood that someone is going to have an adverse psychological health reaction based on hazard exposure to psychosocial hazards, we need to understand the severity, frequency and duration of exposure to that hazard. If all we're getting from a employee perception style survey from a risk assessment is, do you work to demanding deadlines, or do you work very fast and you have to, respond on a like it type style response, 7-point scale, let's say, from strongly agree to strongly disagree, doesn't tell you the severity of the stress experienced based on that element of work design, doesn't give you the frequency and duration of stress, because we know that people have different preferences, right? Some people like a heavy workload, some people like to just be told what to do, yet we automatically assume that work overload or lack of autonomy are hazards, and people will experience stress based on exposure to that. So these tools are dumb in that they don't pick up on that nuance that people have different working style preferences, and not all work design elements will affect people in the same way. And if all we're getting as an outcome from these measures is, hey, on a 7-point rating scale, you got 5.1, and we're going to compare you to a benchmark, which is across industries, and the benchmark, let's say, is 5.2, what do you do with that information? What does it tell you? It just tells you that maybe you're doing slightly better than a benchmark, but what does a benchmark mean? On that result, what's the likelihood and consequence of harm? Well, it doesn't tell you that. So really, I would say that these tools are not psychosocial risk assessments. At the very best, I would say they're hazard identification. So it might give you some idea about what are the main hazards that are present in different work environments. But to understand the risk, then you have to then really unpack the results of those surveys in focus groups or interviews. And then you end up with a qualitative risk assessment. So I might as well go, lick our finger, put it up in the air and go, okay, well, on this quadrant, we believe the risk is there. And the problem is when you take that sort of information up to a board or exec level, and you go, based on our focus groups, these are the main hazards that we identified. It's hard to then go, well, is this actually quantifiable data? Is this a real risk that we're seeing here? Or is it a bunch of people who had nothing better to do on a Wednesday afternoon and had a free afternoon tea and they just want to have a bit of a whinge?
Yeah, so I think for me, when we think about this methodology of doing essentially a work factors survey, because that's what it is, you're assessing work factors, you're not assessing hazard or risk. And then you're following that up with workshops that people are volunteering to participate in. And then while they're participating, they're also volunteering how much they want to share about their experience. And if you think about all of the different influences that come into play there when somebody's deciding what they want to talk about, you've got significant questions then about, well, how representative actually is this information that we've collected from these focus groups. I would say anecdotally that people who are more likely to participate are probably those people who are less vulnerable in terms of mental health, certainly less vulnerable in relation to the organisational pressures on mental health. So, for example, people who have potentially experienced harassment or bullying, particularly from a top-down perspective, will be less likely to participate. People who have experienced organisational injustice will be less likely to participate, unless you've got people who are just so angry that they're ready to essentially blow the place up, figuratively, not literally. Then they might, but again, then you're potentially getting a skewed response there as well of people who are incredibly dissatisfied, who have potentially secured another job and are really ready to just burn that bridge right down.
Yeah, so we see a lot of problems with that approach, and then that creates, for those people who've had that experience, often this is just done once because it's so distasteful and leaves such a bad taste in their mouth, I should say, that they're like, oh, that was horrible, that process, I don't want to do that ever again. And so often then, the alternative is a top-down risk assessment where we just get a bunch of people in the room and we go, okay, well, what are our main hazards? Let's think about the controls that we've already got in place. And then you end up with a risk register that has psychosocial hazards as the hazard, not a specific one. It's just like a group term for all things that cause work-related stress. And then you go, well, these are existing controls. Well, we have EAP. We have lunch and learns every now and again. We have policies around bullying and sexual harassment and paid time off work and those sorts of things. And they'll be like, great, so we understand we have hazards or risks. We're saying that's a 2 on our 5-point likelihood consequence risk, and we're saying that these are our controls. It's not really understanding your hazards and addressing the risks systemically. It's going, this is what we've already done. So we're talking about a top-down risk assessment that really just doesn't really give you much detail, and then you end up with global level controls that, are they really effective or not? We don't really know.
Yeah, and so, that's essentially akin to doing one risk assessment across an entire, plant or construction site or something like that, where we know that we actually need to do a risk assessment on different activities. You can't just do one global activity for an entire location. You do actually need to, okay, well, we're working at height, but even then, well, what is the particular job? What is the height that we're working at? What are the conditions around that? And actually looking at it at a job level. You can't just do a global risk assessment and be done with it. You do actually need to get into the nuances of the activities and jobs that are being conducted, understand what the hazard profiles are for those jobs, and make sure that your control measures are targeted to those unique hazard profiles.
Yeah, and these top-down risk assessments don't understand that the workplace and the environment is dynamic. It changes every day, and that's why before doing hazardous tasks, people in these roles generally have to do a risk assessment before they do any activity to ensure that they're noticing any things that have changed in the work environment since they were last there. And there's thorough handovers as well.
Yep.
So if you're doing a once-a-year top-down risk assessment, you're really not understanding that workplaces are very dynamic. I mean, if anything, the pandemic should show us that a lot can happen in 12 months. So if your cadence for doing a top-down risk assessment is 12 to 18 months, you're missing out on a lot of hazards and a lot of potential psychosocial injury concerns.
Yeah, and again, if if all you're doing is a top-down assessment, you're really not you're not even doing a good hazard identification, let alone a risk assessment, because this really needs to be a bottom-up approach where you're doing really consultation in breadth and in depth, because you don't know the tolerances of your workforce, so it's because individual factors have such a significant role to play here, and the interaction between the workplace and the individual factors is significant. And if you don't do a really good consultation, then you're not going to know what are the hazards that are actually creating the greatest levels of distress for your work, and what are the hazards that are actually creating the greatest risk of psychological injury in your employees. The only way that you can get there is to do a really good quality consultation.
Yeah. Yeah. And that's, again, I guess why we started on our journey, right, with Flourish. Yeah.
So I wasn't here when you started Flourish Dx. I've only been here for a year. So can you...
Feels like a lot longer.
I know. It feels like it's been a billion years. How did you start with Flourish Dx?
Well, I guess back in 2017-18, I saw what really prompted the recommendation in the Boland review that you referred to earlier. So for those listeners who aren't aware, we have referenced it on previous episodes, but the Boland review was a review by Marie Boland of the Workplace Health and Safety Act, and what needed to be updated to, I guess, address current concerns and changes in Australia. And out of 34 recommendations, the second recommendation was to have regulations that dealt specifically with psychological health. We have relied on a general definition of health for quite a while that was always supposed to address both physical and mental, but employees didn't read it that way, and it wasn't very enforceable by the regulators either. But back about the same time that she was doing that review, I was observing that there was a rapidly increasing frequency and duration of psychological injury claims being made in Australia. I knew that the current approaches to psychosocial risk assessment using these employee perception style surveys, it wasn't getting traction. I knew that in 2018, the ISO 45003 standard, that would be the first international standard to be internationally agreed upon on what was best practice, was starting to be worked on. And I knew, given that it was a child standard of ISO 45001, there was going to be a real focus on risk management and continuous improvement, which is different to the popular methods of the day, and the popular methods still exist today, which is more downstream and focuses on individuals and symptoms. So I knew if we were going to have impact at scale and really get companies to start to take a more systemic risk approach to psychological health and safety, there needed to be an enterprise tool that felt as, nice and intuitive as any other kind of enterprise tool that was in use, whether that was an employee engagement survey or a safety management system or risk reporting system or something like that. There needed to be a bespoke tool for this. And I guess when we started, we actually started working with a local university here on the first iteration of what the risk assessment would look like. And it did very much take that employee perception style methodology. We called it the work design survey, and it still exists within Flourish Dx because some people still like to ask those style of questions. But what we quickly learnt was, not only were we not getting the right information out of this, and we really had to rely heavily on the focus groups to actually inform the risk assessment rather than the survey. But also there was a lot of objections when you started to bring that into a workplace, and then HR would review it and say, well, look, this is actually very similar to our employee engagement survey. Why don't we just use that or expand upon that? And so, we really had to start thinking, well, this isn't cutting it. It's a really time-intensive activity. We're talking generally 20, 30 minutes plus, and, things like people at work, for example, is a, easily 30, 40-minute survey, if not longer. It needs to be more time efficient. We need to get better data. We need to get through some of these objections that we might have with HR. So how can we address that? And I guess you actually came on board, Joelle, in February of last year when we were really wrestling with some of these things, understanding that the work design survey wasn't cutting it and what we were going to do. And it was interesting because at the time we'd been working, we have a school-based product, right, called Flourishing at School, and the school-based product is actually where we started. With the technology front anyway. And we realised that when COVID hit and a lot of schools started going to remote education, that there was a need for them to be able to do pastoral care, so check in with students whilst they were doing school from home. Because typically pastoral care would you'd be able to walk past a student in your classroom and be able to see whether they're their usual self or not, and be able to have a conversation. So we had this tool that we created in response to that, which we called the Wellbeing Check-In, that would get people to, first of all, on a like-it type style response with emojis representing mood, get people to check in with how they feel. But the important part was to then reflect on what are the personal factors that are influencing how I feel, but then also what are the school-related factors, whether that's exam pressure or whether it's that you miss your friends or whether it's that, you've got relationship issues with a teacher, for example. What are the factors both from that individual and the system perspective that are influencing how I feel? And that was, really effective for schools at the time to be able to get a pulse on how students were doing. But then we thought, well, if all we're doing from the work design survey is helping us to identify hazards, and it's taking us 20 to 30 minutes to do that, could we use something like the Wellbeing Check-In, which is a 30-second tool, to be able to get the same level of information? And long story short, the answer is yes. So I actually believe you can get better information from this 30-second assessment than you can from, say, a 30-minute psychosocial risk assessment using employee perception style methodology. So that's good because that means you can collect that data more frequently. So most companies who use the bulky risk assessments only do it on a 12 to 18-month cadence because it takes so long. Or they time it in with their employee engagement survey and do it that way. And so you don't really get to monitor the hazards as they're emerging. You can't see whether your controls are being effective in a timely manner. You've got to wait for the next cadence of surveys. So it's much better in terms of the cadence of data. It's only 30 seconds. The data is reported live. It doesn't take you weeks or months to review the data and then report down and do your next level of consultation. We've had it before where, we presented to a new company who was starting to use the tool and they had 20 people on the call. So I got all 20 of them to grab out their phones, do the wellbeing check-in on the call. We identified that out of the 26 had responded negatively to the check-in, and 4 of them said that isolated work was contributing to them having that negative check-in. So talking about, the goal of psych health and safety, it's to identify what are the hazards that are having a negative impact on people's psychological health. Well, in 30 seconds, we identified, there's a systemic issue here, isolated work. That was in peak lockdown in New South Wales, by the way. It had been for months. But that then was enough for the line manager to say, this is clearly not just one person's inability to cope. This is a problem with how we're doing work currently. So how could we make people feel more connected whilst working remotely? So we're talking about it being quite an agile way of doing psychosocial risk assessment. All the data is there, available after a few, 30 to 60 seconds. You can bring it up and have that conversation within a team and address it at that team level. Again, not at a global level, you're actually dealing with the issues for the team. So we kind of stumbled across that methodology because of the work that we're doing in schools. But we've just been really surprised with how effective that is at that first step of that risk management process, identifying the hazards.
Yeah, so that's a really important point to make there, is that we're only identifying hazards at this point. We're not actually understanding the risk associated with those hazards. So they may be the hazards that are front of mind for people on a particular day when they're doing the check-in, not necessarily the hazards that are actually creating the risk of psychological injury.
Yeah, and we're not understanding the likelihood and ultimate consequence of that hazard exposure either. It's just in that moment, this is what people are feeling and these are the things that are contributing. But like I said, if all we're getting from a 30-minute long employee perception style survey is a list of the main hazards that are present that we then need to unpack within a focus group, why not use a 30-second assessment to do that?
Yeah, no, absolutely. As you said, one of the things that we started to talk about when I joined was how can we actually do this better? How can we get more usable data that does actually speak to risk rather than just talking about work factors that are high or low compared to a norm?
Yeah, that's right. And I guess that was the next part of it, right? We thought, at scale, companies aren't going to want people, all of their employees, after doing a 30-minute long survey, to then sit in a 2-hour focus group to unpack the results and come up with that qualitative risk assessment. And if you think these numbers are off, just look at the regulatory impact statement written by Deloitte for the draft regs in Victoria. They're estimating 2.5 hours of time per employee to do your consultation requirements on an annual basis. We don't think it needs to take that long because Joelle and I were thinking, at scale, you're not going to get that commitment from companies. You're not going to be able to do the focus groups with every single employee. What are we trying to get? What's the information we're trying to get out of a focus group? Well, what we're trying to do for each of the identified hazards is to identify the severity of that. So to what impact is that having on people's psychological health in terms of making them feel stressed or overwhelmed or needing to take time off work? What is the frequency, though, that is occurring? And then what is the duration of that exposure as well? And so we thought, we're not getting that information from the work design survey. Why don't we create another type of assessment that can be rolled out at scale to collect that information? And that's where our work factors risk assessment was born out of. And so we thought, if the Wellbeing Check-In, if we run that 2 or 3 times, if we can identify our main hazards from that, because if it's consistent or, the same things are coming up, that's hazard identification done, then we can really tailor and ask follow-up questions just regarding those main hazards. So instead of having, a survey that has to include every psychosocial hazard under the sun because you don't want to miss anything, you actually have a clear idea of what they are based on a few wellbeing check-ins that have taken a few minutes of people's time over a few months. Let's now ask follow-up questions just on that. So it might only be a 5 to 10 minute risk assessment rather than a 30-minute risk assessment. But for each of those, we ask on a 10-point rating scale, to what degree is this having a negative impact on you, making you feel stressed, overwhelmed, angry, or upset? Noting that not everyone experiences the same response to a psychosocial hazard. Then what is the frequency of that exposure on a 10-point rating scale, and then what is the duration? So automatically, we're actually getting a lot better information from every individual than what we would with an employee perception style survey. So rather than 3 or 4 questions to cover a construct like work overload, So questions like, I have to work to demanding deadlines, or I have to work very fast, and people answering strongly agree to strongly disagree, and you get kind of like this rating, well, workload appears to be somewhere, that's low, medium, or high. We're getting severity, frequency, and duration of that hazard exposure as it pertains to that individual's response to that hazard. So it's a lot smarter in that sense, and you're getting 3 data points for every hazard rather than 1. Now, what is the true innovation within Flourish Dx is what's coming up next as we start to build predictive algorithms regarding that risk. So everyone who participates in Flourish Dx, unlike something like a People at Work, which is completely anonymous, they do it through a username. So from our end, we can actually link people's data from survey to survey longitudinally. And so 3 to 6 months post people doing a risk assessment, we're asking them questions around burnout, time taken off work due to work-related stress, around psychological distress. And we're building a predictive algorithm that will actually tell the likelihood and consequence of harm based on how a group of people have responded to that work factors risk assessment for each of the identified hazards, or each of the hazards that we've assessed, plus what is the cumulative risk based on the interaction of those hazards together. Ideally, what we want to get to is quantitatively being able to say to an employer, well, you'll have a risk score out of 100, which was 80. Now, we know, based on all of our data sets, that if a company has a risk score out of 80, then that means that if you don't do anything in the next 6 months, 30% of your employees are going to experience burnout. 20% of people are going to take time off work due to work-related stress. 2% of people are going to make a psychological injury claim through workers' compensation. So that then, I believe, will actually be the first true psychosocial risk assessment, because it will give you the outcome that you expect from a risk assessment, that is likelihood and consequence of harm. And you can imagine if you feed that up to an exec or board level, they then truly understand the risk, and then they can determine their risk threshold. They might go, oh, we're comfortable with that. It's an employer's market, and as people will burn out, that's fine. But if they're really thinking about their duties as directors of a business, going, well, actually, we have a legal and moral obligation to protect the health and well-being of our workers, and we're not comfortable with that. Well, how do we get to a level of 70 out of 100 instead of 80 out of 100? And what does that mean in terms of predicted outcomes for our people? So that is really exciting. I think it's the first time we've actually shared that with the listeners, and that's probably because we're so close to being able to release it that no one's going to be able to duplicate what we're doing in terms of our methodology before we get that out. So yeah, really excited to share. That's where we're going with Flourish Dx, and it is really very different to how we've done psychosocial risk assessment in the past, both in terms of the time saving, both in terms of the data that we're collecting, and then that predictive analytics is the next level that we really need to get to.
Yeah. So I think probably important to note around the confidentiality. So while at our end we're able to do that sort of tracking and longitudinal analysis and comparisons, for the employer, they're not able to track or monitor individual employee responses.
Yeah, that's right. And that was really important to us, right? If people are going to be participating in something that is, often perceived as a very sensitive topic, they needed to be able to do so anonymously. Now, we do share with employers if people have completed the risk assessment or not, but we only share de-identified aggregate data once a minimum of 8 people have responded. And, we work with companies to, create filters that reflect their company structure and locations so that they can really filter down and start to compare between groups and go, is this a global issue that we're experiencing, or is it relevant only for certain roles or areas of the business? We call it, if you think about the occupational hygiene approach, it's kind of like similar exposure groups. You're identifying, well, are there groups that experience this more so than others? And so, yeah, but it always has to be that minimum of 8 people to be able to see de-identified aggregate data to protect the individual's anonymity. And the beauty is, again, all of the data is reported live. So for ultimate transparency, what we actually suggest to companies is best practice is to do this not like a employee engagement survey and just email blast everyone and ask them to participate. You're going to get very low levels of engagement if you do it that way. But within a dedicated time with the team, whether that's over a dedicated Teams call, or whether that's live in person, which is happening less and less these days, actually set aside some time to do it. Again, it only takes 5 or 10 minutes. but have the dashboard open live. And the line managers all will only get access to their team through our platform. So you could have your team data up live. You can share the results and go, okay, these are the key things that are coming up. We're going to have a further look at this data, though. We'll come back to you. We'll do some further conversations and then start thinking about our action plan. So it really makes the whole risk management approach a lot quicker, not just in terms of the time per employee, but you've got the data available immediately. You don't have to have someone spend 2 or 3 months analysing it, presenting it back, by which time maybe the issues have changed and the data's old. You can do it in the room. And in fact, we've had some of our clients who have already, within a half-day workshop, done their risk assessment, done the follow-up, what does this mean, creating an action plan. That's all everyone's signed off on within a half-day workshop.
Yeah, and so when we talk about, issues or barriers, and survey fatigue often comes up as one of the barriers, I think this is a really key aspect of that, is that, people can actually see their results immediately. If you're doing it in this way, where you're actually setting aside time, dedicated time, which you should be, because it's a risk assessment, it's not an engagement survey. You don't allow people to decide whether or not they want to participate in a safety risk assessment. It should be the same for a psychosocial risk assessment, that people actually are required to participate in that. They can see their results immediately, and they're engaged in talking about those results immediately. And ideally, they're actually contributing to solutions, and they can see those solutions being formulated and implemented very soon after participating. So that really takes away the survey fatigue, because the fatigue is more about, I'm continually being asked to contribute my time to give information to my employer, and then either they do nothing with it, or by the time they give me some feedback, the only feedback is, here's the results. I don't really see what they're going to be doing with it, or if they do something with it, it's already 6 months down the line, and things have changed since then. So I think that the visibility of their results and the ability to turn those results into actions very quickly really takes away that challenge around survey fatigue.
Yeah, so we've said that, I think, before on the show, that it's not the surveys that cause fatigue, it's the people who are running the surveys poorly that do that. So, if you can do the survey live in the room, share results immediately, and start taking the follow-up consultation steps in the room, that's perfect in terms of people actually feeling I'm being heard and something's being done about it. Another issue we're coming across, I guess, when talking about Flourish Dx, is sometimes objections regarding pricing. So some companies say, well, we don't have a budget. And in fact, for many companies that haven't had a psychosocial risk management approach before, it's a new budget item. They've never actually spent money in this area. And that's why we're conscious to go, well, and we've spoken about it. I'm not going to go into detail about it today, because we've spoken about this maturity continuum that we see companies are on. And a lot of companies, they're just starting to recognise that mental health is good business, but they're really focusing on that self-care. And we see that really as pushing responsibility for risk management down to the individual, rather than thinking about your role as an employer to create a healthy environment where people don't get ill in the first place. But to that point, there's other things that companies are looking at servicing employees with in relation to mental health. One of those is to create mental health awareness through education, and another bit is through the provision of self-care resources, like access to mindfulness, access to interactive activities that people can do to practice self-care better. And that's one of the reasons people have asked me before, Jason, if the risk management stuff is so innovative and that's the stuff that you really want to focus on, why are you doing all this other stuff around e-learning and self-care and mindfulness as well? And one of the reasons is that companies often don't have budget for the risk management stuff, but they have budget for the other stuff, either through their learning and development budget or through their HR and wellbeing budgets. So if you can combine those budgets together that you have, then you can actually buy a tool that services all of the requirements that you might have in a business, that you're already maybe spending multiples on, in terms of having multiple vendors that you're dealing with and multiple subscriptions to different services. So we're like, well, why not just combine everything into the one? So for those out there listening, that is something also to keep in mind when considering Flourish Dx, and where you might be able to get the budget from in your organisation. There's probably already a budget out there for wellbeing type activities and for e-learning or other training regarding mental health awareness.
Yeah, I think the other important point there is that, that mental health is a shared responsibility. And so, yes, employees do have an obligation to take steps to maintain their own mental health. So it is about still providing the tools and supports for employees to be able to do that. And, evidence-based tools and supports as well, I think is an important point to add to that.
Yeah. And I got to say, Alicia has borne the brunt of a lot of that. When we said, okay, well, we do want to have a good mindfulness library because we know that is a good evidence-based approach to deal with stress. Alicia was the one that had to make sure that it really cut the mustard in terms of not being airy-fairy, fluffy meditation stuff, but really had a strong psychological basis to that. So thank you, Alicia, if you're listening to this podcast episode, for doing that. That was many, many months just to create 30 mindfulness activities in the app.
Yes, it ended up being a larger project than we'd anticipated.
Yeah, absolutely. Turns out you can't just buy mindfulness meditations. There's a lot of work that has to go into them to make sure that they are evidence-based and actually helping people to practice elements of mindfulness in a scientifically reliable way.
And not every voiceover person can read a mindfulness track.
No, talent is hard to find.
Yes.
Absolutely. So that's probably enough. I think that's, I think for many of our listeners, hopefully they got a bit of value out of that, being able to explore the topic more in depth than what we have, and maybe even talking a bit more about what we actually do.
Yeah.
Yeah.
So if listeners haven't got tired of our marketing and want to find out more about Flourish Dx and the tools that are available, where can they go?
So on top of the podcast, our other education channel is our 45003 Academy, available at www.45003.org. You'll notice not only is there a foundations course on the standard, there is also activities like creating a business case for psych health and safety, and also one on how to conduct a psychosocial risk assessment, where we talk through our methodology and the tools that I've referenced on this podcast episode as well. So that's probably a really good course to do if you're interested. The other thing is, you may or may not have heard before that we do now have a free version of Flourish Dx available, Flourish Dx Basic. All you need to do to get into it, you can add up to 12 people on one account, so you can actually start to use these tools within small teams, is go to www.flourishdx.com/get-started. We will put links in our show notes to these, plus some of the other resources that we've spoken about. But you can get in and start using the resources there. So I think that's it for today, Joelle, given that you have no follow-up questions. So I guess just to remember that we do video these things when we talk through them on the podcast. So you will be able to see this video up on the Flourish Dx YouTube channel. There should be a clip or two that we'll be sharing on the Flourish Dx LinkedIn page as well. But please do check out the resources in the show notes. There's probably some good links and further learning that you could do from there. And if you've got any questions or any input for further expert series sessions between myself, Joelle, and Alicia, feel free to email us or slide into our DMs on LinkedIn. But that's it for today. We'll catch you next episode.